under stress? Well, first of all, I should say that I'm not a stress specialist, but I've been asked to deal with a subject which is very common to all of us, and it's very common to everybody's practice, even the doctors and the patients and everybody. Now, for the introduction to stress, now what is stress? That's very important. Well, it's a dynamic system of interaction between individual and his or her environment. As an individual perception phenomenon, somebody say we are stressed with that sort of work, that much of work, and somebody will say I'm not stressed, but it's basically a perception, and it's an individual perception, and it starts from imbalance between the demand and the ability of an individual to control that demand. And it's a part of everyday life, we all know that, and it's not an illness but a state of typical who is under stress. So there is demands and coping, and that's stress. Now what is homeostasis? Well, everybody of us goes under stress, but we somehow manage to diverge from all those stresses and try to cope with our day-to-day life. But there is a break point, and what maintains us for everyday life stress, to rule out that, there is homeostasis, and it's basically a good health, where a steady state of an equilibrium is maintained in all organisms. And you can see here, as is depicted, there is healthy homeostasis and the disturbed homeostasis due to the stressors. And that's it. Now what is stressors, which actually causes the stress? There are typical types of stressors. One is psychological, environmental and physical. I'm not going to the details of that. Now look at the global scenario here. During the 1990s, there were actually pneumonia, the diarrheal diseases, the heart diseases, and the diseases of the newborn, severe depressions. Those were the problem creating different aspects. And now in 2020, what you are seeing here, actually infections are still there, but it's going down, and the heart diseases, the lifestyle modification diseases, what we all know, and a shift from the infectious disease to the neuropsychological disorders. That's very important. That's very, very important. It's not only a global scenario, it's even in India. You can see here that the college-going students are suffering from stress. It's 81% almost. And the working individual, the elderly people also. So people who are retired, still they are going through so much stress. It's a data. Well, how is it linked to our body? Actually, it affects two major body systems. One is the hormonal, and there is the nervous system. Mainly it is the HP axis what gets affected, and the sympathetic nervous system which gets affected. Now this is the stress response. There is a flow chart you can see here. The stressor causing the stress, there is neural interactions, and there is HP axis stimulation, and the sympathetic nervous system also gets stimulated. There is cortisol release, adaptive responses, and there is protection against stressors. Now this is the stress response in individual with poor coping ability. Similarly, there is nothing much to say here. And what are the symptoms? That's very important for being physicians. All of us, there are some physical symptoms, emotional, cognitive, and the behavioral symptoms. Look at the physical symptoms. The body aches and pains, diarrheas with constipation sometimes, nausea, dizziness, chest pain, tachycardia, loss of sexual drive, frequent colds, sweaty palms, weakness, tiredness, breathlessness, hyperactivity, muscular tension, teeth grinding. So a large chunk of physical symptoms are basically very non-specific. You cannot specify when the system is involved. There are some emotional symptoms. You see there are mood swing, very common. Irritability and frustration is also there. Agitation, sense of loneliness, anger, substance abuse is also there. Phobias, patients have phobias. So these are the emotional symptoms. Again, a very non-specific kind of symptoms. The cognitive symptoms, the memory symptoms, the memory problems, inability to concentrate, poor judgment, seeing only the negatives, anxiety, constant worry, fearful anticipation, loss of objectivity. So again, a lot of cognitive behavioral problems. Now the behavioral problems, eating disorders, anorexia people who suffer, sleeping too much or too little, procrastination or neglecting responsibilities, increased arguments, domestic or workplace violence, overreactions and all that. Now the systems affected by stress, you see almost all the systems of our body gets affected due to the chain reaction, the cardiovascular, sleep centers, reproductive system, immune system, every system gets affected. Now there are typical lifestyle modification diseases like diabetes, hypertension and all that, and stress is related to all those things. You see here stress affects diabetes by both its onset and its exacerbation, and the physiological effects on the neuroendocrine system induced by the stress can affect directly to the blood glucose levels. I think this is quite common. We are going through the diabetes, the pathophysiology of the diabetes, insulin insensitivity, the lipotoxicity, glucotoxicity, all these things come up. Now that I am skipping, it's quite common. Now the clinical studies, there are some clinical studies have been shown, but these are not randomized controlled trials. So obviously these are just observational means for the systolic blood pressures, the diastolic blood pressures, the cortisol level and all those. And you can see here there is, after stress there is high systolic blood pressure. There is diastolic blood pressure is also gets affected. The salivary cortisol effects gets affected after stress. All these things are quite common. So it's obviously when the stress is experienced in the postprandial period, acute psychological stress significantly increases glucose concentrations in patients with type 2 diabetes. Well, again here you can see that there is probability of diabetes gets increased, permanent stress, 42.6% probability, the periodic stress and the no stress level. So obviously the self-perceived permanent stress is an important long-term predictor of diagnosed diabetes independently of socioeconomic status, the BMI and other conventional type 2 diabetes risk factors. But again, these are not randomized controlled trials. Similar studies, just keeping here. You see here the stress day, the cortisol, the control levels of the systolic blood pressure, how it goes up. Diastolic blood pressure again, the stress day, heart rate. Well, so stress and hypertension also, similar type of things. The three main pathophysiology here, the stimulates the vasoconstriction, inhibits the vasodilatation, and there is sodium and water retention all through. I'm skipping, I think almost here. The metabolic syndrome. Well, it goes without saying that it affects. The metabolic syndrome is characterized by, you know, that obesity, elevated triglyceride level, high blood pressure, increased fasting glucose levels, low concentrations of HDL, good lipoprotein. The stress and the metabolic syndrome here, you can see that get affected quite. So it stimulates catecholamine, there is increased blood pressure, stimulates angiotensin 2, stimulates endothelium, and there is vasoconstriction, inhibits kallikrein, inhibits nitric oxide, vasodilatation inhibits, and there is stimulation of sodium reabsorption, and there is sodium and water retention. Stimulates gluconeogenesis, stimulates the glycogenolysis, glucagon secretions, and also inhibits the glucose utilization, lipolysis also. So increased insulin resistance. Fat metabolism also gets disturbed, stimulates the visceral fat growth and function, stimulates immediate productivity, stimulates triglyceride production, and all that. Okay, so stress and neurodegeneration. It also is there, you know, the stress induces the release of corticotropin releasing hormone, adrenocorticotropic hormone leading to the release of glucocorticoids. The corticoids, hippocampus, modulation of the synaptic plasticity change the dendritic structures and loss of neurons there, leading to memory loss and neurodegeneration. Alzheimer's disease also, it has a magnitude effect there. The Immune dysfunction. Stress can cause decrease in type 1 cytokinins, increase in type 2 cytokinins, so hypersensitivity gets increased, host defense gets decreased, so obviously they're susceptible to different viral infections. Now come to the stress management approaches. There are mainly 3 approaches. One is lifestyle modification, natural supplementations, and the pharmacological therapy. The lifestyle modification, obviously, some breathing exercises, progressive muscle relaxation, massage, yoga, meditation, all have been tried. But these are all lifestyle modification disease, not much of help possibly. People who are able to do these things regularly might have some help. Lifestyle modification approach is non-specific. In my personal view, I have seen my patients who are in yoga, meditation, chronic rheumatoid arthritis patients. Sometimes those people get Reiki, but they have that sort of a stress relievers, but not that much significant effect. There is inter-individual variability. There are some natural supplementations, herbal remedies. The limitations is what the quality and well-characterized efficacy with different mode of action is lacking in this approach. But still, there are a lot of patients who will ask you regarding these things. Regarding the pharmacological management, the benzodiazepines, alprazolam, clonazepam, you can use it. Anti-anxiety, depression medications, not used for frank stress, obviously. Long-term use can cause these problems, dependence, tolerance, addiction, sedation, hangover. So it's a very difficult situation. Pharmacologically, it's very difficult to manage the stress and all that. Now, it's a very new molecule has come up for the management of stress and all that. And I personally don't have very good experience, but I've used near about 15-20 patients in my OPD. About 20% patients, I feel they have good response, but I don't know why. And while other 12 or 15 patients, they haven't that response, I don't know. But it's a very new molecule. We need to assess that clinically in our day-to-day practice, whether it is responsible for decreasing any stress or not. It is the Relaxium. It's basically a milk protein which is hydrolyzed. Contains a patent bioactive peptide with relaxing properties, and the active compound is basically a decapeptide, a major milk protein after trypsin hydrolysis, a common digestive enzyme. It's very common in newborn, but not in adults, and that is because of, I'm coming to that. It's a decapeptide. That's the structure. Is based on belief that milk has relaxing properties when consumed by newborns. And researchers have wondered about the calm state of the babies after drinking milk. So they got an idea that there may be something in the milk which is causing that calmness. And the peptides produced when milk is hydrolyzed by pancreatic enzymes, trypsin. Enables the molecule for specific spatial configuration that gives it anti-stress properties. You see here the structures, basically trypsin hydrolysis, and showing the Relaxium how it is produced. Now, as you can see here, in case of an infant, there is specific bioactive decapeptides are formed because there is unaltered milk protein. But in case of adults, there is no relaxing effect because there is trypsin gets activated. And you can see here Relaxium has structural homology with human endogenous diazepam, which confers affinity for GABA. Activation of GABA receptor associated with opening of chloride channel and leading to reduced nervous transmission and regulation of anxious and stressful life. So it reduces stress, induced increase in plasma cortisol and other neurohormones, prevents harmful actions of excessive stress in my body. No sedative effect. Several specific benzodiazepine binding sites, omega 1, 2 and 3. Relaxium selectively binds to omega 2 binding site of GABA receptor, explaining its only anti-anxiety role, where as benzodiazepine binds to omega-1 and omega-2 binding sites, explaining its sedative and anti-anxiety action. Now this is the recommended dose, 150 milligram per day, and from the first dose itself, Relaxium starts controlling stress induced by chemical changes. The research says, however, the real sense of well-being appears after 1 month, depending on the level of stress and individual, as stress is not an overnight event. So obviously the stressors should be removed along with these pharmacological therapy. That's very important. You have to find out the stressors, and the dosage can be increased if severity of stress is severe. So clinical studies on that. Different clinical studies also. They have measured the parameters, systolic, diastolic, plasma cortisol, stress-induced psychological methods and physical methods. You can see that Relaxium-induced pressure significantly increase, reduce systolic stress, also there, regarding in comparison to the placebo. Effects on Relaxium on stress-induced diastolic blood pressure, so obviously it's decreased with placebo. Still, it needs a large randomized controlled trial to prove all these things. The plasma cortisol level, 0 hour, 3 hours, they have shown there is some decrease with Relaxium levels. Relaxium offers anti-stress profile by preventing increase in the systolic blood pressure, diastolic blood pressure, and the plasma cortisol level. It's a clinical study too, which also proclaims similar kind of results here. Significant improvement in the digestive, cardiovascular, intellectual, emotional and social symptoms of stress. So it decreases also the sleep disorders, restores a good sleep without being sedative. In one of my experience, a person who was suffering from irritable bowel syndrome, I used it, and it was, I personally found is a good effect regarding the sleep. People who with irritable bowel syndrome, they quite often suffer from insomnia and all those things, and there's a good result in that patient. And the study also shows that. So even if there is, if you don't think the patient is not stressed enough to use any pharmacological therapy, there are some indications also you can use it, so that might give results. So there is some chronic diseases also, stress association. In addition to control stress, Relaxium also offers improved sleep quality, better cognition, feeling more energetic, offers relaxation, reduces day-to-day worries and tensions, reduces stress-induced increase in heart rate, reduces perception of stress, being a natural product, safe, free from any side effect. These are the positives I take actually, and all are very good effects. So this is it with the Relaxium and stress, and it's mainly my personal experience with the Relaxium that I can share. I know, but this is a very new molecule and it has come up just now, almost 3-4 months in the market. And I'm using it with my personal experiences.
Any negative effect? Any side effect? Or not positive effect?
At least till now I haven't seen. I've used it very few patients, obviously, 15 patients almost.
But even in literature it has not mentioned that hypersensitivity.
No, not that.
It's a protein.
It's a protein, that's right. We need to see, we want to do more randomized control trials with large number of patients. I think these are needed, and I think we can do that.
It is approved by US FDA. I'm going to the literature. It is approved by US FDA. There is no.
Obviously, they haven't seen that sort of hypersensitivity. Although it's a protein.
Yes.
But the advantage is that it's a natural protein almost. It was there in the newborn, and it was hydrolyzed and produced something, which was so. It's not that sort of an antigenic effect in the body. It's not that antigenic. So I don't have any personal experience, and also there is literature also says not much of an hypersensitivity.
GABA agonist.
GABA. So I think we need to use it. I'm using. Then we can look through this whether it's working too well with the patients and not. It's very non-specific. Stress management is a very non-specific issue, and with those lifestyle modifications, and one thing that is very important. Many patients ask me regarding this pharmacological treatment that whether we should use it and we can get cured. There is no cure basically. We can, all these lifestyle modification diseases, we can check these things in a certain level of sense, but we cannot cure these things. And also we have to leave apart those stressors. We have to find out that. That's very important. I think that is the basic point of the stress management, rather than this pharmacological therapy. So thank you very much.
Any question? Any further question? Thank you, Dr. Maitri, for sparing his valuable time and coming here and giving us this beautiful lecture. As he rightly told, this drug is not a miracle that if you take it, you will become stress-free throughout your life or something. Not that. You have to continue taking, and simultaneously you have to get checked. What are the chronic stressors that is affecting you, disturbing you? Unless you remove those stressors on a long-term basis, you cannot get cured of stress totally. Number two, you have to do all these lifestyle modifications, and here he don't have any experience about those yoga, meditation, etc. I am here running a yoga and meditation since last 20 years, and I have found they have a very beautiful relaxing effects. He don't have any personal, obviously he should not have, because he don't put any effort there. I have found that relaxation, meditation, all these lifestyle changes, they have a very beautiful, dramatic effect. At least I am now under my care about 368 people. I have admitted them in that yoga and meditation center, and I have studied that they have very beautiful relaxing effect, like this auto-suggestion, relaxation, Jacobson's progressive relaxation, all this yoga nidra. We are doing it officially here. I am a director of yoga and meditation center here.
But I want to ask you one thing: how many patients are young in your
Actually,
institute?
Young, we have found that basically they are very effective beyond above 35 years. If the person is above 35 years, all these have a beautiful dramatic, and I have found that below 35 they don't concentrate also any of this. If you teach them also, their mind is, they don't fix to this. After 35, I have dramatic response. Below 35, I have a poor response.
Because of the non-compliance, mainly because of the non-compliance.
And this drug might prove some beneficial effect. This is a very new drug. I propose that we may have some study here taking care of our cardiology, and because they mainly most of the research concerned with cardiology, metabolic syndrome, and with Dr. Malik, so we can have some research on what to, and cardiology unit to find out. Probably we will be in a better position than he, because our population is bigger. Our population is bigger and our budget is bigger. So if we start, probably after 1 year we'll go to lecture him. Okay, thank you. Thank you for patient hearing, and thank all the team for doing this. खाना लेके जाइएगा साहब. कंपनी आप कुछ बोल रहे हैं तो 2 मिनट बोल सकते हैं. किसको रिलैक्सियम चाहिए तो आप इनसे अप्रोच कर सकते. मुझे डेंटल डॉक्टर मांग रहा था रिलैक्सियम. कहाँ गया?
टेम्पल हम लोग खा के देखेंगे.